Hey, good morning. This is Christopher South, and this is our monthly video education for November 2020. And we're going to be looking at a little bit of stuff about COVID this morning. So here we go. Going to kind of get things going for you guys here in just a second. All right, so we're going to take a look at our presentation, which is on COVID-19. So the purpose of putting this presentation together is the other day we had a meeting and we started talking a little bit um, about our different experiences and things that we have with COVID-19. And so I was kind of challenged to come up with a presentation and discuss what we know now about COVID-19, and started doing quite a bit of research about COVID-19 and wanted to share a little bit of that with you guys. So let's take a look at the first 100 days of COVID-19. So this all started right around the end of December. So on December 31st, 2019, the first case of an unknown pneumonia was reported in Wuhan, China. About a month later, on January the 30th, the World Health Organization declares a global health emergency. Again, about another month later, within 58 days of the onset of this illness, cases are confirmed on every continent except Antarctica. March 11th, the World Health Organization declares the spreading crisis as a pandemic, and by April 3rd, there's more than 1 million cases reported worldwide. Look how fast this thing spread within the first 100 days that it became a worldwide pandemic. And here's the thing, folks, as COVID-19 is on point to become the third leading cause of death worldwide. So let's understand our enemy, COVID-19, and we need to kind of look at this as just like we're battling anything, and we're definitely on the front lines, and it's definitely a battle that we're in with COVID-19. So we need to understand our enemy. And so let's kind of go through and learn a little bit about what COVID-19 is, how it spreads, and a little bit on what we know. So this is how it enters in an attack. So it gains entry. All right, typically what we're looking at is how it gains entry is somebody breathes it in, they get it down into their lungs, which is the route that we're going to look at right now. And it's very similar to a key and a lock. The virus uses a little crown-shaped spike proteins. We see it looks like a little golf ball with spikes sticking out of it. And those spike proteins work as a kind of a key to enter a cell and replicate. And so that's what those little things sticking out are, kind of like keys. It helps go into a cell and replicate. So it is believed that COVID-19 suppresses the immune response. There's quite a bit of research going on thinking that when COVID-19 actually enters into the body, that it actually causes the normal immune response to slow down. But it's also believed that COVID-19 can trigger an immune storm response very similar to anaphylaxis. So what happens is it hijacks and takes control of a cell. The virus releases RNA and actually forces the host cell to replicate its biological code. So you can see right there in the picture, if you can kind of follow my mouse right there, is you see looks like little tentacles that are spanning off of the virus. And what these do is these tentacles kind of reach out, and that's what goes in to the host cell and attaches, replicates, and bad things begin to happen. And what it does is it basically goes in and replicates and then destroys the host cell, starts creating more and more of our little viruses that are going to go around and starts destroying all of the host cells. and it kind of picks an unfair fight. So immune cells called macrophages release cytokines, which are proteins that dilate blood vessels and recruit virus fighting cells. And so what happens during this process is basically it causes an influx of white blood cells that attacks of infected cells, but also healthy cells as well. And when that does that, it causes an inflammatory response, actually causes inflammation. And this is where we start having a lot of problems, is that inflammatory response. So let's take a look at that inflammatory response. So fluid fills the cavity of the alveoli. As you can see, as we start seeing a loss of surfactant, we start seeing a protein-rich fluid that enters in. We start seeing protein and cellular debris as formation of scar tissue, and it makes it where it's more difficult to breathe in the alveoli. And in a severe response, all right, in severe cases, the immune response actually overreacts, contributing to multi-system failure, which can lead to septic shock. So is it sepsis? Yes, it can be. We're starting to see patients who develop over into sepsis and everything. And so we need to be very careful when we're looking at these patients with COVID and everything. Are they developing sepsis? We need to start kind of digging in and seeing what else is going on, because we're starting to see systemic failure in some of these patients. So let's take a look at some of the effects of COVID-19 on the body, and it can be from no symptoms all the way up to death. And this is where we're really going to get into it. So I found this really awesome slide right here, and it says COVID-19's damaging effect on the body. So I want to go through all of these different systems and talk a little more in depth about it. So when COVID-19 first kind of came out, most of us, including myself, thought it was just going to be kind of a souped up flu. That's really what I thought about it. I thought it was just going to be kind of a worldwide influenza, kind of similar to the flu of 1918, something very similar to that. And at first, that's what everybody thought. But now we're learning that COVID-19 is so much more than that. And it affects so much more than just the respiratory system. So it does affect the heart. Doctors have reported inflammation to the heart and damage to the cardiac muscle. And so we can start seeing releases of troponin. But one of the other things that they're seeing is a lot of patients start developing AFib. And patients can also have developed AMI from COVID-19. So the blood vessels, and we're going to talk a bit more about this in a second, as we're seeing blood clotting in major arteries and veins have been reported. Those clots can break off and damage multiple organs by stopping blood flow, which can lead to AMI and also stroke. And we're going to talk about that here in just a second, so hang tight. But one of the big things that we're seeing is kidney damage, kidney impairment, impaired kidney function. And so many of these patients develop severe enough kidney injury and kidney dysfunction that they may require dialysis. And we're seeing a lot of abnormalities in the function of the kidneys. So what we were talking about a second ago is about that blood clotting stuff and everything. So we were starting to see neurologic dysfunction with seizures. And one of the things we're really seeing that was very surprising is that a large number of young people are having stroke associated with COVID-19. But one of the things that we're seeing as well that's involved with the central nervous system is the loss of taste and smell. And this is a dysfunction of the neurological system. So the main thing that most people are familiar with is damage to the lungs. The virus can cause pneumonia, in which the lungs become inflamed and, of course, fills with fluid. Patients may require ventilation. As the infection progresses, the virus can also cause serious lung injury, which can become fatal. And so one of the other things that we're also really seeing with this is we're seeing about roughly 20% of patients report diarrhea as an early symptom. The virus has been found in the lower intestinal tract of some patients. And so here are the most common COVID-19 symptoms. These are the ones that most people experience. fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, a headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea can also be associated with it. So, based upon a survey of patients worldwide, 88% of those patients who were surveyed by the World Health Organization experienced a fever. 88%. Mucus production, which is a productive cough, 33%. A dry cough was seen in about 68% of patients. Shortness of breath was associated with 19%. Fatigue, about 38%. And sore throat and muscle pain was both about 15%. So looking at that, the biggest things that we're seeing is that fever, dry cough, fatigue, some of those big things that we're seeing. And not everybody is going to have every symptom. And we're going to talk a little bit more about that. So I asked quite a number of people, folks that work here locally at Metro, but also asked friends of mine from other agencies and all over the globe if they had COVID-19 and if they could kind of share some of their experiences. And so I kind of gathered all of this information up, and I was actually really surprised is that some people had no symptoms at all that were COVID positive. Some were very, very mild and may have only had one symptom. Maybe it was just a loss of taste or smell. Some of them may just have felt kind of like they had like a cold or a very mild flu for a day or two and it felt fine. And then others got very, very ill with it. And so the thing is, as most of us, when it first came out, we thought that only people who died from COVID-19 were folks who had severe underlying health conditions. And what we're seeing now is that's simply not true. And I want to share some of my personal experience. I had a firefighter friend, one of the healthiest guys I know, man. This guy, he could have actually just walked right off the page of one of these fitness magazines. He was just that guy. He just enjoyed working out, very healthy, came down with COVID-19. And unfortunately, my friend lost his battle with COVID-19. And it really opened my eyes that patients with no underlying medical issue at all who were very, very healthy can still die from COVID-19. And I was chatting with quite a few different people, and we were talking about how when these symptoms, they can just hit out of nowhere. It just seems like it just kind of takes the life out of you. And my own experience was with COVID-19 is I developed a headache first. And I get headaches quite a bit. I get stress headaches. Just kind of goes along with the business, I guess. And that's what I thought of it. And the morning I was supposed to go teach an ACLS class. And I tried to pick up one of our boxes with some equipment in it to carry it upstairs. And I thought I was going to pass out because I was so short of breath. And that's when I realized that something was wrong. And I went and got tested. And several days later, it was confirmed that I had COVID. But I went ahead and isolated immediately as soon as the symptoms came on. And by the time that I had left work, I didn't feel feverish or anything. About 3 hours later, my temperature was 104.4. And I kept a temperature for almost the entire time with COVID. And I had some severe shortness of breath. I had my SpO2 had even dropped quite a bit and was very, very ill from it. And so I can tell you that COVID-19 is not fun, as people can have very mild symptoms, no symptoms at all, or can be very, very ill with it. So it is a virus, and so there's all kinds of weird treatment things that are being put out there. I mean, you'll see on the internet about using these vitamins and this and that. But here is really what they're telling folks to do, and it's very simple, is hand hygiene, which we want everybody to do anyway. Rest is going to be one of the biggest things. Social distancing, so think about that 6 feet, and especially if you're symptomatic or you've been confirmed to have COVID, you need to isolate. Uses fever-reducing medicines and also other medicines that can help with some of your symptoms. Drink plenty of fluids, and again, clean and disinfect surfaces regularly. But a lot of folks don't want to hear that. They think there's a magic pill to fix this, and there's simply not. There's not a Z pack. There's none of this stuff that you can do. Is we're still learning, and it's going to be a while before we figure out what works best. And patients don't want to hear that, and um, it's really kind of heartbreaking because I know what it's like to be very ill and to not be able to, to get the what you think you're just going to get, like a something magical at the hospital and it's going to fix it, and it's not. The virus has to kind of write it. You have to kind of write it out. So for us as emergency medical folks, we need to learn a little bit about the serious complications and emergency care for taking care of these patients. So one of the big things, and one of the most common calls that we get is going to be a shortness of breath call associated with, well, the code that comes out 10120, which indicates that patient potentially has COVID-19. So with dyspnea and hypoxia, we want to treat all hypoxic patients who are below 94% with oxygen. We want to titrate that oxygen just to raise that SpO2 to above 94%. Great caution should be used on choices to use aerosolization medications, intubation, other high-risk respiratory and airway treatments. However, if that patient needs that and we can justify giving it, go ahead and treat. We want to make sure that we're taking care of those patients, but use caution when doing those. So one of the things that we're learning about is called happy hypoxia. So happy hypoxia is a silent hypoxia. And what happens is these patients can be hypoxic and not present with the typical hypoxic symptoms that we would see, which would be, shortness of breath or, the patient being quite ill and stuff. And so I have a patient who's very much hypoxic. It could be playing on their phone, and we don't think anything about it. We think it's a problem with our equipment and just kind of blow it off. So when we have a patient that we suspect with COVID-19 and we put them on the SpO2 and it's low, we should assume that they are hypoxic until ruled otherwise, is because they're seeing patients that look normally fine, that have what's known as silent hypoxia or happy hypoxia, going to have SATs that are in like the 70s or even lower than that. And so one of the other things that we're seeing as well is we're not seeing an equal correlation with what is found in the SpO2 to what is found in arterial blood work. And so anytime that we have a patient that we suspect with this and we're looking on our monitoring system and we're seeing that the SpO2 is low, we should go ahead and assume that it's not an equipment failure, that we should go ahead and treat it until ruled otherwise. Is because it's better to go ahead and treat that patient than to let them remain hypoxic. So fluid, should we use it or should we not? And so speaking with some physicians here locally and some other professionals and also doing some research, is that what we are seeing is because of that inflammatory response, and we're seeing swelling in the alveoli and also that poor kidney function, that bolusing these patients may not be the best thing, and we should. So here's the thing: crystalloid fluid bolus, if indicated for the treatment of a patient with confirmed or suspected COVID, should be conservative and closely monitored. And so that means if we've got a patient who's hypovolemic, is being careful, is making sure that we're monitoring that fluid bolus, and we shouldn't overload these patients with fluid. And this includes giving fluid challenges to patients that maybe they have suspected COVID-19 and we check their blood glucose level and their glucose level is high, is because their glucose level is going to be high is because they have that inflammatory response. It's going to affect their diabetes. And yes, we want to try to get that down, but we want to be very conservative when we're giving those fluids. So the new normal in healthcare is PPE, and it's going to be around for a long time. And me personally, Out of all the years that I've been doing this, we hardly ever wore the PPE that we're wearing now. It's only a few times a year that we'd put on an N95 mask, and one of those was doing your fit check. We just didn't use this equipment then. But here's the thing: is we are going to be using this equipment for the foreseeable future, and we have got to get well versed in its use, understanding it. And so the best thing is to get educated. So the N95 is going to be the gold standard when it comes to healthcare professionals as far as protection. So the N95 mask are a regulated respiratory face mask designed to protect from airborne particles. N95 masks are regulated by the FDA as well as by NIOSH under the regulatory collaboration of the FDA and NIOSH. All right. So N95 masks, a good way to look at it is they provide at least 95% protection against airborne particles, bacteria, viruses, body fluids, and other things. N95 masks have a unique airtight seal fit and design that features headbands and a tight fitting nose piece. N95 masks are sized to the individual wearer and must be fit tested. So you have to be fit tested in order to wear these masks, all right? A lot of places are foregoing that and doing that, but really, if you got a mask that's too big or too small, it doesn't fit correctly, it doesn't work for you, it's not going to provide the protection. Your PPE is only as good as if you are using it properly. N95 mask, according to NIOSH, can be reused up to 5 times. So if you've got a mask, you use it on 5 patients, you should get a brand new. And this is NIOSH. This is what NIOSH is saying now. So the new fashion accessory is our mask. All right. And so I want to talk a little bit about mask, the culture of wearing the mask, and a little bit about to kind of dispel some of the silliness that's going on. Number one, I'll just be completely honest. I don't like wearing a mask. It's uncomfortable because we're not used to it. And the more we wear it, the more we're going to get used to it. And I notice now that the more that I wear it, the more that it becomes kind of natural. It's just going to be a part of who we are now. And I'm actually kind of enjoying getting all the cool little mask and everything. Every day I've got like a brand new mask. I've got like all my little Star Wars mask and everything. And it's something kind of cool. I get to add my own little flavor to my uniform now. But masks are proven to help with the prevention of the spread of COVID-19. They are proven to work. Masks have been used to prevent infection, that we've been using them for long periods of time. Even back in 1918, during the Spanish flu, they were using masks. So this is not a new concept, folks. All right. And the wearing of mask is not some kind of government conspiracy, and certainly that is not a call to a revolution. All right. To take up arms or whatever, to not wear a mask. It's the right darn thing to do. All right. And here's the reason why everybody needs to wear a mask. As I've seen, there is so much misinformation that's out there about masks, and it's silly. I saw stuff that said if you wear a mask, it's going to make you hypoxic, completely untrue, that it traps bacteria in your mouth, all kind of stuff. And I've seen this from professionals, even EMS professionals, and it really kind of hurts my heart a little bit. But here's the thing. If you have COVID-19, you can be asymptomatic from 2 to 14 days, or you may not be symptomatic at all. However, you can absolutely spread COVID-19 during this time period. And so these are known now as super spreaders. And the only way that we can prevent this from happening is by everybody wearing their mask. And so let me try to not be gross about it or anything, but somebody sent me this great little meme the other day that perfectly explained why you should wear a mask. All right. If you got a friend, all right, and you got pants on and they come and pee on your pant leg, all right, that is an example of infection being spread. All right. If you got your pants on and they pee on it, your pants are going to get wet. All right. If they have their pants on and they pee in it, only they are going to get wet and not you. So that's what we're talking about, is wearing your mask is so you don't spread it to others if you don't know about it, but others can't spread it to you. I know they're not 100% effective. I get that, but it reduces your risk. And that's what we want to do. We want to reduce the risk. We want to keep this stuff from spreading. And a mask is proven to work. Wear your mask and encourage everybody else to as well. This is not something where you're trying to save your freedom and everything. This is about saving lives, folks. And we, as lifesavers that we all tout ourselves to be, we need to be holding this flag up. So what can we do? It's time for us as EMS professionals to rise to the challenge of COVID-19. And we are doing that. And man, I understand we are definitely overworked. The the number of patients has definitely increased. Um, it's more difficult, to get into hospitals. There's more transfers. There's a lot more things going on. And so we have a challenge, and we are going to be able to overcome this challenge. We're going to be able to do it. So make sure you're taking care of yourself, folks. As self-care is so important, especially during these very stressful and challenging times. Is let's take a look at some coping things that we can do with COVID-19. The first thing is take breaks away from the news. Oh my gosh, there is so much just nasty, nasty stuff going on. There's lots of misinformation. Anything time there's something terrible, man, they just run with it. There's never anything good that's on there. As us as EMS providers, we see enough bad stuff every day to begin with. Let's try not to fill our lives with it 24 hours a day. So make time to unwind. Find something to go do. I personally challenge everybody, go and do something outdoors. Right now is a great time to go hunting, go hike, go do something outdoors. You can definitely get away from everybody, and it's going to do your body and your mind good. Set goals and priorities. Start looking at things and start thinking about other things other than COVID-19. Start thinking about how you can improve your life. Take care of your body definitely by eating right. I want to really encourage all of our smokers and stuff. This is a fantastic time to quit, because it is proven that smokers are having a much more difficult time with the symptoms of COVID-19. So start taking care of yourself, exercise, start eating right. Just a good, healthy living is definitely going to help, and connect with others. I know that social distancing is one of the things that we're wanting folks to do, but use that technology. Definitely connect with family and friends and keep that going. And the last thing here is definitely focus on the facts. There's so much misinformation that's out there. Let's stick to good sources of information to focus on. One of the other things that we need to do is we need to support other healthcare folks. All right, we need to think of them as part of our team, and that we're on a team together. And this includes our nurses, our CNAs, our doctors, our ancillary staff, everybody. Everybody in healthcare is absolutely suffering during this. We're all overworked. Everything is changing, and staffing wasn't great prior to this. There were staffing shortages in healthcare all across everywhere. Nursing homes were short staffed prior to this. Nursing was short staffed, and EMS has been notoriously short staffed for a long time. And this certainly isn't making things any better. And so one of the things is we have to kind of, and when I was putting this together this morning, I was kind of taking a hard look at myself, and I'm going to challenge myself is to start doing better, is to start being nicer, and to start having a little more empathy and sympathy. Is because everybody is challenged. We're challenged during this crisis, but so are the folks at the nursing homes, and the CNAs and everything. As a lot of them have just started, working into this industry, because we're trying to pump out as many folks as we can to be able to take care of everybody. And so we need to have a little more sympathy for everybody and to be able to take a breath. Yeah, are they going to send out patients that probably don't need to go to the ER? Sure. All right. That doesn't give us any excuse to be a jerk to anybody. And I know it's so easy to, but I want to challenge you guys is let's start being better. Let's not only be better because, we want the company, we want Metro Ambulance to look better, but let's make EMS look better. Let's try to put a good shine on EMS so they can see us in the light that we need to be seen in. And that's that we are leaders, that we're going in and going, hey, we understand that you guys are having a tough time with this just like we are. And we can get through this together if we support each other. So cleanliness is next to godliness. And I think that's one of the things that we have got to make sure that we are doing is being vigilant about cleaning and making sure that not only do we clean our rigs after every call, thoroughly cleaning our rigs, but we need to be making sure that we are clean as well, that we're properly disposing of any PPE that needs to be disposed of. And we should be very, very, I'm talking about stinking, just unbelievably vigilant about hand washing. All right. And I know a lot of us, we just, discard our gloves and walk out of the room and everything. You need to wash your hands immediately. And if let's say you're on the side of the road and you got a patient who doesn't want to go to the hospital and you discard your gloves, you need to grab that hand sanitizer. Let's get to that habit of good hand washing, taking care of the things that we need to take care of. Cleanliness, folks, is next to godliness. We need to educate and enlighten. Is that we want to make sure that we are putting out good things. The public is looking at us. And not only when we're in uniform, but also when we're off duty, we need to be setting that example. So we know that masks are one of the tools that is going to help us to be able to reduce the spread of COVID-19. You need to wear your mask when you're out and about. Set the example. Set the example on Facebook and other social media by putting out good information. If you want to talk about COVID-19, make sure that the information that you're putting out there is correct, it's actual, and there's good research that's based behind it, that it's not just conspiracy theory stuff. Let's educate and enlighten. Let's show the world that EMS are the champions of healthcare. We can be it. And here's the thing, we have got to be ready to learn and be ready for change, is because this is ever evolving. And everybody's like, well, nobody knows what's going on. So let me take you back just a few years. All right, so let's take a look back in the 80s when the AIDS crisis first got started. It was terrifying. It was first thought of as a form of cancer. There was all kinds of different things. And they were like, oh, this only affects the homosexual population, but we learned that that wasn't true at all. That's maybe where it got started and, the first few cases of it, but it spread to pretty much anybody and everybody. And we found out it was, spread through blood. And believe it or not, the universal precautions that we are so well versed in, with gloves and how to utilize good, safe operations with sharps and preventing needle sticks and everything, came about from learning because of the AIDS epidemic. We learned from that. And because of that, a lot of what we do has improved because of that. And the same thing is going to happen with COVID-19. Guys and gals, COVID-19 will improve healthcare. And you're going, how in the world can you sit right here, Chris, and tell us that this virus is going to make healthcare better? Here's the thing. We are learning. We are learning about infection control. We are learning how viruses spread, because this thing came out of nowhere and became a worldwide pandemic almost overnight. We are learning that how things that we think are just affecting one system can affect multiple systems. And because of that, the learning that we're going to get from this is going to improve all kinds of areas within medicine and hopefully EMS. One of the things that I'm hoping for is definitely is I'm hoping that the federal government will see that there needs to be an increase budgetary stuff for every EMS agency, that they see the value that we bring to the table in healthcare. And we're going to learn from this. And the only way that we can show that and the way that we can improve is to be open to learn, open to gather research, and for us to not be stuck just on our EMS stuff that we do, is to learn and to be a team with every healthcare professional, because from epidemiologists to the folks in the lab, to the folks at the nursing home, we are all in this together working to take care of patients, because that's who it's all about. So folks, hang on. We're going to get through this. It's going to be a part of with us for a long time. But if we just work together, if we just make the initiatives, if we just keep learning, we are going to be able to come out on the other side, just like we did with the AIDS virus. So folks, if you have any comments, questions, concerns, and everything, or if you just need to talk, that's kind of a tough time right now, I'm here for you. So guys and gals, thank you so much for watching today. Make sure that you do sign that roster. It'll be where they always are, in the computer room. So thank you so much for listening to me today. And so guys and gals, have a great day. And I'd like to leave this and dedicate today's education to the crew that unfortunately lost their life while going to save others. Back in 2018, on this date in 2018, lost 3 fantastic crew members on the air crew. And we will always remember them. They will always be in our hearts forever. And we remember them and salute them today. Thank you.